There was one child who was, I think probably 8 years old. He came for a forearm fracture. He didn't even cry. Made me felt that how much they might have gone through in their life to go through this pain. Hi, my name is Shamala. I'm working as a nurse clinician in Sengkang Emergency Department, and I'm working as a nurse in Emergency Department for past 17 years. So in Sengkang Hospital, we do see a lot of pediatric cases. So pediatric management is different from age to age. So their interventions is actually based on their body weight. Over the years, since 2018, we have seen a lot of pediatric cases, non-critical to critical cases also. To handle them, we should have a lot of emotional resilience because we can have a successful deliveries, like joyful moments, as well as like we have tragedies like, pediatric death. I would like to share my recent deployment to the Myanmar post-earthquake. We not only manage the patients who are actually directly affected by the earthquake, we also reach out to the underserved population who typically lack access to the health services. So this mission actually gave me a clarity, the line between a necessity and a service. Over there, we purely actually given like what is necessary for the population over there. Before we finalize our location at the Batu Stadium, we travelled one whole day in a bus from state to state finding an appropriate location. On the next day, second day, we managed to find a location, which is we went to the Mandalay itself because that's where the most affected people were staying. Our team actually went there to recce whether the ground is actually safe enough and when we are not surrounded by any tall buildings around us, because if there's an earthquake happen again, the patient shouldn't be affected. But unfortunately, that night, after 1 hour or 2 hours of putting up the tentage, there was a typhoon came and blew up the whole entire tentage. So that night itself, we went back to the stadium to rebuild our tentage again. To be frank, I was scared because I do have children. I need to come back home for my children. That's the only thing was going on in my mind. I need to be back home safely. I think what is more important is providing service and help to the people over there, because I think the situation was worse than what I've imagined. Every day it was very challenging, but we have a very strong team of very motivating team members around us. So every day what happened is after our services at the site, we have a debrief. We will talk about how we feel and everything. There are a few times that some of our colleagues actually break down. Even I also break down one of the moment there. Then the next day we go there, we will just do our services. And even their own people was so kind towards us. They are not demanding. They are not rushing us through the services, and they are willing to wait despite we are seeing more than 100 cases sometimes a day. Beyond my professional role, helping people in need and providing nursing care gives me a deep sense of contentment. For me, there's no greater privilege than being part of someone's journey towards their well-being and their healing process. Okay, contributing to their recovery, even a smallest way, actually give me a sense of satisfaction. So for World Vision, I've been sponsoring 4 kids in 4 different countries. This will help them with their education and their basic needs. I think the drive in me to help someone is always been there. I do feel a bit of guilty that not doing as much as what I'm expected myself to do. With this small contribution, time to time, it gives me a sense of you are doing something for the society. Emergency department is designed to manage critical and life-threatening conditions. However, most of the emergency departments in Singapore, we are actually managing non-critical cases. If we have a fairer distribution of patients across the healthcare systems, emergency department can focus more on treating and managing life-threatening cases. So now we are very much stretched. I will encourage public to look into this and please approach the appropriate healthcare services. Like not only every cases come to emergency department, you can actually approach GPs and you can approach the polyclinics also. I encourage all nurses to engage more with their patients, listen to their concerns and understand their needs and consider their next of kin situations. And meaningful communication can make all difference in patients' experience.